The CDC changes the science overnight on mask policy, poison control issues warning on toxic chemicals found in the COVID at-home tests, and the Swedish study shows us that the vaccines act upon your body in a way that the CDC promised us it would not. You know, the CDC used to be an organization that had your best interest in mind when it came to health policy, and now they have shown their true colors, which is really good for us, but that is really as a political organization that they truly are. More policy seems to be made over there based on political happenings than science itself. Now, I want to be clear here. I am a little bit biased because I'm biased in the way that I do believe in truth, honesty, integrity, and I also believe in following the real science. And of course, I believe in natural health. Now, I believe that health policy should be made on real science and should not be swayed by politics. Politics have become so deeply ingrained in health policy at this point that it's hard to separate them from each other. And it's quite disgusting. The truth is that health policy seems to always be influenced by big food, big pharma, and whoever is writing the checks, but not often based off the science. I mean, think about this for a second. Think about the garbage food pyramid guidelines. Those have no bearing in real science. Where is the science that shows that the top foods you should eat throughout the day are grains if you want to have good health? You want to be healthy? According to the food pyramid, eat your white bread, your bagels. And I mean, that's really insane in a country that suffers greatly from severe obesity and avoidable chronic diseases. Now, let's move on to an article. There's an article in the New York Times called "The CDC Isn't Publishing Large Portions of the COVID Data It Collects." The article states after 2 full years into the pandemic, the agency leading the country's response to this public health emergency has published only a tiny fraction of the data that is collected. The CDC is a political organization as much as it is a public health organization, said Samuel Scarpino, who is the managing director of the pathogen surveillance at the Rockefeller Foundation's Pandemic Prevention Institute. The steps that it takes to get something like this released are often well outside the control of the scientists that do the work at the CDC. So if it's not in control by the scientists, and the scientists have no say in this health policy, what is it based off of? That's a good question. You can put in the comments below what you think. Now, the president picks the director of the CDC, and as elections approach and the White House gets record low approval ratings, we're seeing massive policy shifts over at the CDC. And they're shifts that many experts have been calling for many years at this point. Now, let me be clear. I think that these policies should be based on science, not political happenings. Now, in the news, there's been a lot of pressure on the CDC to release the proper data so that real healthcare decisions could be made. Then all of a sudden, this happens. The CDC says there's a need for a dramatic shift away from the endless monitoring of cases that are overwhelmingly mild and instead focus only on the actual sickness that lands people in the hospital and threatens life, right? So we've heard forever that like COVID-19 is just excessively bad and very, very scary, and you should all be very scared. And many experts were saying, well, why are we focusing on all the cases? We should actually focus on people who are actually getting sick and winding up in the hospital, and we should focus on deaths. The CDC said, we need to stop obsessing about cases and start looking mainly at medically significant disease. The focus should be on protecting the most vulnerable. Now, isn't that what we've been saying all along? See, the problem with the pandemic is that all the cases have been highlighted and everything has been based on cases, which is insanely high. And let me give you for instance, if everyone that got a sniffle throughout the year tested for the flu, you would see flu cases insanely high, and there could be good reasoning for you to be very scared of the flu because the numbers would seem so dramatic. Now, this has never been how public health has been monitored. And then when the pandemic came with COVID, this is how the CDC started monitoring it. The federal agency now says nearly 3/4 of Americans don't need to wear a mask because they live in areas with low or medium risk from COVID-19. Now, this dramatic switch comes because the CDC switched from only using COVID-19 cases as a factor and are taking into account other metrics, including hospitalizations. According to the CDC, this update approach focuses on directing our prevention efforts towards protecting people at high risk for severe ailments and preventing hospitals and healthcare systems from being overwhelmed, according to Dr. Rochelle Walensky, who is the director of the CDC. Now, under this scheme, over 95% of the country was labeled substantial or high risk. And when I say under this scheme, it's like how they were monitoring it before, where they're just watching all cases. 95% of the country was labeled high risk, even though the COVID-19 cases have plunged in many of the recent weeks. Just 77,000 cases were recorded nationwide on February 23rd. And then what happened? Just like that, folks, the risk of COVID-19 was cut in less than half overnight. Well, why was the CDC scaring the heck out of everyone for all this time if this is the switch they were going to eventually, inevitably make? And why was this switch all of a sudden made? You know, this is truly unbelievable. After the update, the substantial risk column was totally removed, and now just 37% of the US counties are deemed as high risk. Well, what changed in the science? Nothing, absolutely nothing. And can you believe that this organization is responsible for making health policy for you? Now let's go ahead and move on from this, okay? What we've been seeing as of lately is the poison control centers are warning us about toxic chemicals in our at-home COVID-19 test. There's a Cincinnati Drug and Poison Inflammation Center reported an uptick in accidental exposures to a possibly toxic substance called sodium azide in the at-home COVID-19 test kits. Meanwhile, the National Poison Control Centers issued a warning about the chemicals, and they said, if someone drinks the solution that's in these testing kits, it's really important to contact poison control right away. The solutions have different ingredients. Some are non-toxic ingredients and others are very dangerous. So obviously, make sure that if you're getting these test kits sent into your home, that you are reading the directions carefully, using them appropriately, and of course, keeping them away from small children. Now, next up on our list of topics, Pfizer's COVID-19 vaccine goes into the liver cells and is converted into DNA, according to a new study. Now, the messenger mRNA from Pfizer's COVID-19 shot is able to enter the human liver cells and is converted into DNA, according to a Swedish study from researchers over at Lund University. Now, this is really interesting because the CDC told us something very different about these shots. The researchers found in this study that when the mRNA vaccines enter into the human liver cells, it triggers the cell's DNA, which is inside the nucleus, to increase the production of line 1 gene expression to make mRNA. The researchers stated, in this study, we present evidence that COVID-19 mRNA vaccine BNT162b2 is able to enter the human liver cells in vitro, the researchers wrote in the study. Now, this study is published currently in the most current issue of Molecular Biology. Now, the whole process occurred rapidly within just 6 hours, according to the study. Now, you might ask, why is this important and who really cares? Well, here's why it's important, and here's why you should care. More than 215 million, or 65% of Americans, are fully vaccinated as of February 28th, with 94 million having received a dose of a booster shot. Now, the vaccine's mRNA converting into DNA and being found inside the cell's nucleus is something that the Centers for Disease Control and Prevention said would not happen. The genetic material delivered by mRNA vaccines never enters into the nucleus of your cells, the CDC said on its webpage, Myths and Facts about COVID-19. Now, we've all been told, if you believe in this kind of stuff, you're a conspiracy theorist. Now science is proving it to be true. Now, this is the first time that researchers have shown in vitro or inside a petri dish how mRNA vaccine is converted into DNA on a human liver cell line, and is what health experts and fact checkers said for over a year could not occur. And to put it quite simply, this does, in fact, happen, according to the most recent research. Now, according to one expert, the concern here, because you might be asking, well, what's the concern? The concern here is that the Swedish study's findings have enormous implications of permanent chromosomal change and long-term constitutive spike synthesis driving the pathogenesis of a whole new genre of chronic diseases. Okay, so the concern is that this could just cause all kinds of autoimmune crises in people. It is very unclear as to what the future holds with these shots. The data and the details from the Pfizer vaccine have still not been released, so the world is really taking Pfizer's word on this, that it's safe for the short term and for the long term. Now, this company has been sued billions of dollars for wrongdoings against humanity. I wouldn't trust them, and I wouldn't trust this company to tell me the time in a room full of clocks. I hope you enjoyed this video. If you like this one, I think you'll really like this video next.